Hi everyone, this is Nitin. I'm an experienced OET trainer. In this video, I'll teach you how and when to use elimination strategy while attempting Part B of OET reading. We know that Part B consists of 6 different extracts related to healthcare topics. And from each extract, there are multiple choice questions with 3 options. The extract can be a memo, email, or even a notice. Now, coming to our topic, I have seen that many students use elimination strategy to perform almost all of the question, but that is not necessary. We need to use elimination strategy only in case when there are more than 1 or 2 answers for a question. With the help of 2 sample questions, we can learn when and how to apply elimination strategy. So let's start the video. You can see the question and extract on the screen. When you are given a question like this, firstly, it is very important that we need to read the question and understand its meaning properly. So let me read the question for you. The question says, the guidelines state that the healthcare workers should. This one is an incomplete question. So firstly, we need to understand what the question is asking us to find out. The question is basically asking us to find out what should the healthcare professional do according to the given extract. Now, coming to the option, it is better to read the option at the last because there is a chance that you might get confused with certain options which can act as distractors when you start reading the extract. So let us keep that for the last. Now let us look into the extract. You can see that the extract is about infection control, best practices for healthcare settings. Now I'll give you some time to read the extract by yourself, and after that we can go through it together. I hope you have gone through the extract. Now let's start with the first sentence. The first sentence states the importance of personal protective equipment. Actually, that first sentence is not answering your question. So the first sentence is not associated with an activity that or something that the healthcare workers should do. So we'll move to the next sentence. The next sentence states that the use of personal protective equipments like gloves, masks and gowns should be guided by a risk assessment based on the nature of patient's condition and the type of procedure being performed. That means whenever a healthcare professional use PPE, they should use only after a proper risk assessment of the patient and the type of procedure that will be performed. So actually this sentence is answering your question. Anyway, we'll read through the remaining extract. The next sentence states that routine hand hygiene needs to be followed. It says that it is fundamental and gloves needs to be used only when in contact with bodily fluids or contaminated surfaces. Now this sentence is also answering your questions. That sentence gives us some kind of information or an action that healthcare workers should do. Now moving to the next paragraph. PP must also consider the patient's clinical context. The same thing, the clinical context of the patient needs to be considered before using PPE. The next sentence is an example, so I am not reading that because it's not answering our question. Now we'll move to the last sentence. The last sentence talks about the importance of documentation before using PPE, particularly when dealing with highly infectious disease. So the last sentence is also answering your question. It is something that a healthcare worker should do while they work. Now we can see that from the extract we have got 3 answers for our questions. Firstly, the use of PPE needs to be done only after a proper risk assessment. And you can also see that routine hand hygiene is fundamental and gloves needs to be used only when the healthcare worker is in contact with bodily fluids. And lastly, you can see that the importance of proper documentation by the staff whenever they use PPE, particularly when dealing with highly infectious disease. Now, with these 3 answers, we can move to the options. If any of this information is there in the option, that will be the answer. If the option is contradicting the information, we can eliminate that. So let's read the first option. Healthcare workers should prioritize the documentation of PPE sometimes. Now, is the option A correct? No, it is wrong. You can see that in the last sentence, it states that whenever PPE is used, proper documentation needs to be done. However, option A states that it needs to be done only at certain or only at some times. So we can eliminate option A. Now let's move to the option B. Option B states that healthcare workers should assess the need for personal protective equipment based on the situation. Is that option correct? You can see that in the second sentence of the first paragraph, it says the same thing, that before using PPE, proper risk assessment needs to be performed. And the same meaning is conveyed by the option B. So we can't eliminate option B, and that is answering the question. It's in the extract. So anyway, let's check the option C also. Option C states that healthcare workers should follow the same infection control measures regardless of patient's condition. That is actually wrong. From the same sentence itself, the second sentence from the extract, we can see that the use of PPE needs to be based on the patient's condition. Only after a risk assessment it needs to be done. Also, the first sentence of the second paragraph states that PPE use must also consider the patient's clinical context. So the same infection control measures doesn't apply in every cases. It needs to be followed by a risk assessment of the patient. So we can eliminate option C also. That means option B is our answer. I hope this is clear for you. So just like I stated before, we need to perform elimination strategy only when there are multiple answers for the questions from the extract. I hope that's clear. Anyway, we will do one more question. The second question is presented on the screen. Let us read the question. The question says, the guidelines recommend that nurses should. So actually the question is asking, what should the nurses do according to the extract? Now let's start reading the extract. So the extract is about safe practices in medication administration. Okay, now I'll give you 1 minute to read the extract. Read it carefully, and after that we can discuss the extract. Okay, I hope you have completed reading. Now let us check the extract. First sentence is about medication error. It says that it's a significant concern. However, the first sentence is not answering our question because it doesn't state anything that the nurses should do. So we can skip that. We'll move to the second sentence. Second sentence says that to minimize risk, nurses are advised to follow a double-check protocol for medications identified as high risk, particularly those with narrow therapeutic window. Here, the sentence states something that the nurses should do. And what is that? They need to double check protocols before giving or administering medications, particularly in the case of high risk patients. We'll move to the next sentence. Electronic health records provide valuable information, but verbal instructions, if given, should always be documented and verified. So here you can find information related to importance of electronic health records. And it also says that if verbal instructions are given, it needs to be documented too. So this sentence is also answering our question. We'll move to the next one. Additionally, medication should only be administered following clear authorized prescription regardless of the urgency of the situation. So this is also that the health nurses should do while they give or administer medication. That means they need to follow a proper protocol. The prescription must be an authorized one. And whatever be the urgency, they need to stick to the protocol. Now we'll move to the next paragraph. First sentence states that healthcare professionals must also stay updated on the changes to medication protocols and attend regular training sessions on safe administration practices. That is pretty clear. Next one, pharmacological reference material should be accessible at all the times, and any uncertainty regarding dosage or administration should be resolved before proceeding. So this sentence also states something that the nurse should do while they give medication. Now coming to the last sentence, it states that documentation of all administered medication is essential to maintain accurate and reliable patient record. So the last sentence is actually giving or saying the importance of documentation. That is not something the nurse should do. It's giving a fact or giving us an information regarding the relevance of documentation. So in this extract, you can see that there are a lot of answers to a question. Many sentence states the thing that the nurse should do while they administer medication. Now we'll move to the options. Let's read the first option. Option A states that pharmacological resources should be available with doubts addressed promptly. You can see the information in the second paragraph, second sentence. When you read that sentence, you can see that the meaning matches. The sentence states a pharmacological reference material should be accessible at all times. That means it should be made available at all the time. And any uncertain uncertainty regarding dosage or administration should be resolved before proceeding, which is same as like if any doubts are there regarding the pharmacological resources, it needs to be addressed promptly. Promptly means quickly, without wasting any time. So that meaning that option matches with the meaning of the second sentence in the second paragraph. So that can be our answer, or that is our answer. Anyway, we will check the other two options also. Option B, verify dosages twice when handling all medication. A related information can be seen in the second sentence of the first paragraph, but it says that verification of the dosages. Regarding that, it says that it needs to be performed only in case of high risk medications, not in case of all the medication. That means option B, we can eliminate that. Now coming to option C. Option C states that health nurses should rely on electronic records instead of verbal instructions. So regarding electronic records, you can see in the third sentence of the first paragraph, but the meaning doesn't match. That sentence says that electronic record provide valuable information, but if verbal instructions are given, that needs to be documented. However, option C states that nurses should rely on electronic records instead of verbal instruction. That means they don't need to rely on verbal instruction. However, the extract states that they need to document and verify if verbal instructions are given. So we can eliminate option C also. That means option A is our answer. I hope this video is clear for you. If you have any doubts or concerns regarding the elimination strategy, you can write that on the comment box. Also, if you want me to do video on any particular topic related to OET, you can write that also in the comment box. Anyway, I hope this video will be useful for you. See you in the next video. Thank you.